ECDC On Air,
the podcast of the European Centre for Disease Prevention and Control.
Keeping up to date with European epidemiology.
Hello and welcome to ECDC On Air, where we explore the stories, science and strategies shaping public health in Europe and beyond. I'm your host Nicholas, and in this episode we're diving into the topic of vaccination acceptance, which is probably one of the most talked about issues in health today. From measles to seasonal flu to polio, vaccination remains one of the most powerful tools we have to protect communities. But with declining vaccination rates in parts of Europe and rising public skepticism, how can we better understand what drives people's health choices? To help us take a closer look at all this, I'm joined by two experts from ECDC. Sarah Earnshaw Blomquist, a specialist in applying social and behavioural science to infectious diseases, and also Andrea Würz, who is an expert in behavioural change and risk communication in the area of vaccination. Together with them, we're going to explore what drives vaccination acceptance and hesitancy, how misinformation spreads, and what actually works to increase uptake across diverse communities in Europe. So, hello and welcome to you both. Thanks for being here with me on ECDC On Air.
Thanks for having us.
So starting off with you, Sarah, traditionally ECDC is focused mainly on the biomedical and epidemiological side of public health, like numerical data and tracking the spread of infectious diseases. But your side of the work is a little bit different. Can you explain what social and behavioral science entails in the ECDC context and how you're applying that in your own work?
Yes, and firstly I just want to say that this area of work should absolutely complement the traditional biomedical and epidemiological work that ECDC does and has done for almost 20 years. So social and behavioural sciences aim to also help us understand individual and community level perceptions regarding both the health threats and also the public health measures. And by these perceptions, I mean issues like how people think and feel, also their questions and concerns, and it may be to do with their own capacities and capabilities to actually take up the measures that we are recommending. And also this part about what else is going on in their lives.
And would you say then that social and behavioral sciences is a critical component of public health?
Yes, absolutely. I would say that. And I think there is a growing body of evidence across the European Union, across the world really, demonstrating that social and behavioral sciences contributes to improving the outcomes of health-related policies, programs, and communication.
ECDC has developed a platform for sharing good practices in this field. Can you tell us more about how this platform works and what kind of impact you've seen so far?
Yes, this is a really exciting new platform at ECDC where we're developing a community of practice in the area of social and behavioural sciences for infectious disease prevention and control. That's quite a mouthful, so we call it the ECDC Lighthouse. So we're shining a light on social and behavioural sciences in the area of ECDC's mandate. And the main objectives of this new lighthouse are to provide training, to also link people together with similar experiences so they can share good practices, and also to develop a real knowledge base in the area so people can upload examples of their work, their publications, inspiring reports to share with the community. So far, we've got about 400 members. And the really nice thing about this is that these people represent all the EU countries and they come from very multidisciplinary backgrounds. So it includes epidemiologists, but it also includes people with the social and behavioral science background. It includes people working in civil society organizations. It includes people from public health organizations. It includes people from academia. So the point that I really want to make here is it brings together a real multidisciplinary group.
Turning to you, Andrea, I wanted to focus a bit more on vaccination acceptance and uptake because I know that you work a lot on that. So vaccination, it's one area where behavioral insights are clearly crucial. What do we know about the main factors that shape someone's decision to get vaccinated or not?
There is a multiplicity of factors that can influence the decision of someone to take up vaccination. And the factors, they can vary across time, between countries, at regional level, across population groups, and also depending on specific vaccines. And because this complexity, it's so important to diagnose what is it that is leading to lower vaccination rates. and which factors can facilitate vaccination acceptance. And then this brings us back to something that Sarah mentioned before, the importance of using the social and behavioral science approaches to understand this. One model that can be used to help us identify what are the barriers and facilitators to vaccination is the 5Cs model. And during European Immunization Week, ECDC launched a report that explains more about the use of these models and how it can help to diagnose factors of lower vaccination acceptance and uptake, and also how to use it to design tailored interventions. And I can briefly summarize what the 5Cs are. So, confidence. Do people have trust in the vaccines and in those recommending the vaccines? Constraints. Is it easy for people to get vaccinated? And by this we mean the physical access, for example, to vaccination services, and also the costs of getting vaccinated. Also, do people have access to clear information about vaccination in a language that is easy for them to understand? Another C is complacency. How do people perceive the risk of getting the disease and the consequences of getting the disease? Then there's also calculation. How do people search for and then use information to inform their own risk-benefit analysis about vaccination? And collective responsibility. Do people feel motivated to protect others by getting vaccinated themselves? And then when we explore these different factors, we go away from blanket explanations like saying, oh, it's because they are hesitant. This gives us a much detailed understanding of which are the factors that can be influencing the decision to vaccinate or not vaccinate.
So this is like a tool then that member states can use to kind of like diagnose what the problem is?
Exactly. And in the report that we launched during European Immunization Week is also included a survey tool that is based on these 5Cs, because then countries can adapt this and implement it in their own settings to make this diagnosis of which are the factors.
So what I take from that is that, when we think about vaccine hesitancy, we might just think about people who have bought into a conspiracy theory, but it's actually much more than that.
It's much broader. You really need to explore, because as I said in the beginning, there are so many possible factors influencing. In order to be able to develop tailored interventions, you need this identification, because they can be very different across different population groups. Or you may think that the issue is one thing, but then when you do the exploration, you find out that it's actually something else that is perhaps hindering people to access the vaccination services.
Exactly. So we can pick up on one of the C's there, constraints, which is not really about individual psychological or behavioral factors at all. It's often about structure, sort of environmental structures. So, for example, how easy is it to access the vaccination center? How easy is it to book a time to be vaccinated? And even factors like if I can get time off work, if I'm a parent, is there someone who can look after my children while I go and get vaccinated? Just because I haven't got vaccinated, it doesn't mean that I am hesitant. There might be a lot of other factors in that package that we need to unpack to understand and then adapt our policies, our programs, and our communication to that individual need.
Okay, and that's very important to recognize, of course. What are the key ingredients for designing a successful vaccination program, if you look at it from a social and behavioral science perspective?
We need the vaccine epidemiology, to be able to understand the broad level trends, and also to identify groups or individuals with suboptimal vaccination coverage. But then the social and behavioural sciences bit comes in really to dig a bit deeper and to understand, so in these groups and individuals, what are the reasons why people are not getting vaccinated? Is it because they don't want to get vaccinated, or is there something else going on here?
And I would also add the importance then to develop tailored interventions, because there is no one-size-fits-all approach. And it often also involves other activities, such as partnering with other organizations, be it, for example, medical associations, patient organizations, organizations at the community level that can also help support the immunization effort, and that are trusted sources of information within the communities that people work with. And then, of course, never to forget the key role that the healthcare providers play in the information that they provide to patients, to also support them in their work when they communicate to patients about vaccination.
Absolutely. But if we go into this area of misinformation and disinformation, do you see the impact of this in your work, Andrea?
Indeed, this is a very important topic, and we have also been here at ECDC developing projects in this area due to the impact this has on vaccination acceptance and uptake. I mean, we all live in a very complex information ecosystem. There are multiple sources of information, different narratives circulating, and this can create confusion in the people that are looking for information on vaccination. It can make it difficult also for people to access or to understand which are trusted sources of information that are evidence-based, and all of this can then affect the trust in vaccines and vaccination programs. For example, we developed a project on addressing online misinformation on vaccines, and it includes also an e-learning that people can access in ECDC's learning portal to learn more about this issue.
And in general, what kind of importance do you think that social media plays in shaping perceptions around vaccination?
Well, social media can contribute to the rapid spread and amplification of mis- and disinformation narratives around vaccines. And these narratives then compete with the information that the public health authorities are issuing around vaccination. So it's very important to identify and address misinformation circulating to limit the harms this is doing to vaccination programs. And some of the strategies that, for example, are included in this work that I referred to around how to address online misinformation on vaccines is monitoring misinformation on social media, developing what we call preemptive interventions that are aimed at promoting people's digital, health, and science literacy. So this is creating resilience against misinformation, correcting misinformation through the use of specific techniques, but then this also needs to be done with care because you don't want to become an amplifier of false narratives. And then, very importantly, providing access to credible sources of evidence-based information on vaccination. And here I can also mention the development of the European Vaccination Information Portal. This is a joint project of ECDC, the European Commission, and the European Medicines Agency. And this web portal provides evidence-based information on vaccination, fact sheets about vaccine-preventable diseases, how the safety and effectiveness of vaccines is monitored within the EU. And very importantly, this is available in all EU languages, and the language is adapted to lay audiences.
ECDC has highlighted that vaccination uptake for diseases such as measles remains suboptimal among risk groups in the EU. Can you elaborate on these trends and why it's proving so difficult to close those gaps?
Yes, indeed. So we have seen that following lower numbers of infections with vaccine-preventable diseases during the COVID-19 pandemic, the number of cases of diseases such as measles and pertussis have increased afterwards, so meaning during 2023 and 2024. If we look more closely at measles, we see that in several EU countries, routine childhood vaccination coverage is below the level recommended, and this is 95% of the eligible population vaccinated with 2 doses of the measles-containing vaccine. And this is needed to prevent measles outbreaks and to protect those that are too young to be vaccinated or that cannot be vaccinated because of medical reasons. But then we see these gaps in vaccination among children, adolescents, adults, and this calls for more efforts to close the immunity gap. Now, the factors that are behind this also can be very varied, and this links to something we were discussing at the beginning on the complexity of the different factors that can be playing a role. It can be issues related to access, or that health authorities have difficulties in reaching certain communities with the vaccination campaigns, or lack of information or awareness about the disease and the importance of vaccination, or issues with vaccination acceptance. And again, this is why it's so important to have the diagnosis according to the country, population level, etc. But I would also like to highlight that large parts of the population in the EU follow the national vaccine recommendations in their countries, And there are EU countries that have achieved and sustained high vaccination coverage rates.
So during the COVID pandemic, there was a lot of talk about the response to vaccines and public health messages around that. Would you say that we're in a better place now when it comes to vaccine acceptance, or has public trust in vaccines eroded?
Well, this is actually quite a complex question that would need to be unpicked in its different elements. At the global level, vaccination programs were heavily affected by the COVID-19 pandemic. And this is for a number of reasons, including disruption in immunization services or people not accessing healthcare services. But on a positive note, data from the EU showed that during that period, the vaccination programs appeared to be more resilient, and many EU countries were able to maintain vaccination coverage in 2020 and 2022 at similar levels to previous years, and I think this is important to be highlighted. Now, in relation to confidence in vaccines, there have been biannual surveys done in the EU by research organizations looking at how the confidence in vaccines has evolved and, for example, comparing 2018, 2020, 2010, 2022. And these studies were showing that a large proportion of the persons that participated were holding positive beliefs toward vaccines. But the confidence was fluctuating, and it was varying depending on specific vaccines and also by age groups. So it was observed, for example, that confidence was declining in the younger generations, which is, of course, an area of concerns. But also there were large geographic variations in confidence across EU countries.
I think also what we can add with this 5Cs model from social and behavioural sciences are these other 4 factors that can help to build a more nuanced picture. So confidence, yes, but also we can look at issues like complacency and constraints as well to help to build this picture of, okay, in this population group, why are we seeing suboptimal vaccination coverage at this time?
And then there have been more recent academic studies looking at the effect of the pandemic in confidence in vaccines, and it is showing that there has been an impact in confidence. But then the reasons of this can be very varied, again, showing the complexity of this topic. But then in general, confidence is a very important factor in vaccination acceptance and uptake. And what we see is that in countries where there is a high level of trust, the uptake of vaccination is higher. And confidence is related to multiple aspects of trust. For example, in the effectiveness or safety of vaccines, in the health system that is providing vaccination, in the policymakers who are perceived as the overall decision makers on vaccines and vaccination.
And it's very easy and quick to lose trust. And I think that is something that we need to look into and understand much, much more linked to vaccination, because vaccination is also one of these issues that has become rather polarized and is very linked to the sort of broader political discussions that are going on in a country and in the world.
So Sarah, your team is very much looking at how social and behavioral science can be integrated into the public health strategies across EU member states. So are countries using these insights effectively, or is there still a lot of work to be done?
I would say both, really. And bridging back a little bit to the document that we have recently launched with the operational support with the tools and methods from social and behavioural sciences to promote vaccination, acceptance and uptake. Within that document, we have a library of 30 or more examples of national and subnational interventions from across 14 different countries. And also, I think there are 3 examples of EU-funded multi-country interventions. And so I think the richness of this library really shows that these methods are being used, but at the same time, there is a lot of work to be done. There is underinvestment and under-prioritization of social and behavioural sciences within public health. And we see that at policy level, in terms of the political level instructions that public health authorities receive. The social and behavioural sciences is rarely mentioned. And we see it systematically through public health organisations as well, that there are not enough managers who know how to include and apply these sciences.
So I guess it's a bit of a paradigm shift. People need to change a bit their way of thinking about public health.
Absolutely. And that's what our mission is in terms of the group at ECDC that has been established to really focus on social and behavioural sciences. And I think the fact that we exist now as a group sends a very strong message from ECDC that these sciences should be included.
I'd be curious to hear a little bit more about this catalogue of interventions that you mentioned in the report that you just released. Can you name some specific interventions that you thought were interesting?
Yes. One of them, for example, which addresses complacency and constraints, is to do with reaching rural and marginalized communities. For example, misinformation may be spreading, or where it may be due to geographical reasons very difficult for people to get themselves to a vaccination centre. And in this context, trusted sources of information are very important. So working with civil society groups, but also an intervention like a mobile vaccination unit, bringing vaccination door to door, really work to increase vaccination coverage in these groups. Another example, which focuses more on confidence but also complacency about the diseases, is an intervention to support a more open dialogue between healthcare personnel and parents ahead of childhood vaccination. And their qualitative research had been done with the healthcare personnel, the vaccinating nurses in this case, and the results of this research showed that the vaccinating nurses didn't feel confident in addressing all the questions from the parents. And they also felt that they lacked sort of structured approaches to actually running the dialogue. And so here the intervention focused on fact sheets in terms of giving the nurses information that they needed to respond to the questions, but also giving them a structured approach based on motivational interviewing.
The healthcare providers, which are often the most trusted voices on health, do we know about vaccine uptake among themselves? Do their confidence in vaccine influence the wider public?
Yes, indeed. Healthcare providers clearly play a key role in promoting vaccination acceptance and uptake. And as you mentioned, they are widely recognized as a trusted source of information on vaccination, and people follow their recommendations. Many studies have shown that healthcare workers' attitudes and knowledge regarding vaccines may not only influence their own vaccination intentions, but also the intention to recommend vaccination to those that come to them for consultation. We actually did a project that was several years ago looking at this topic in several EU countries. And what we found out is that there were high levels of confidence in the benefits of vaccination, but some healthcare providers did have concerns, for example, on the need for certain vaccines or on the safety of particular vaccines, especially for vaccines that were newer. So this is, again, why it's so important to understand the vaccine-related attitudes and behaviors also of the healthcare providers, and also then develop interventions that are targeting these groups, and also to provide them with information, with materials, and with trainings that can support them in their work when they communicate with patients. And we have also at ECDC developed projects in this area. Earlier this year, we actually launched an e-learning on vaccination acceptance for frontline healthcare providers to support them in their discussion with patients, and then also providing information material that they can use to address some of the common questions that people may have in relation to vaccination.
And I just wanted to add that the behavioural diagnosis is a really important step to take even for the healthcare providers themselves, because, Andrea, you talked quite a lot about confidence issues, even amongst healthcare providers themselves. But what we've seen in some of the research is that there can also be constraints issues. You know, these people, they're humans too.
Exactly.
They have busy lives.
Mm-hmm.
And they also need to be able to get themselves to a vaccination centre during working time. So initiatives like mobile vaccination units, for example, can be very effective in terms of increasing vaccination coverage.
So we're reaching the end here. I wanted to have one final question to wrap up a bit. If you would give one piece of advice to public health teams or policymakers who are trying to improve vaccine uptake in their communities, what would that be?
Yeah, I think if it's just one, then I would say really these multidisciplinary approaches are really essential for successful vaccination programs. And this means combining approaches from social and behavioural sciences with campaign and communications expertise, as well as the traditional epidemiological and vaccinology expertise. And I would just add that also keeping an eye on broader public and political dimensions can have a big impact, as vaccination has become an increasingly polarized topic that we see being discussed in the media, in social media, and at political level.
Andrea, would you agree with that?
Yes, I fully agree, Sarah. And I would also summarize this in a nutshell that there is no one-size-fits-all approach. Brings us back to this issue of requiring a multifaceted approach, and also highlight the importance of clear messages on the importance of vaccination that come from trusted sources and that are culturally relevant and that can resonate with the intended audiences.
Couldn't agree more, Andrea.
Well, thanks to you both for being here on ECDC On Air. It was a pleasure to hear your insights.
Thanks very much, Nicholas.
Thank you very much for inviting us.
Please let us know what you thought of this episode by giving it a review or a comment. For more information about ECDC's work, visit our website or follow us through our social media channels.